Vitamins. So our next chapter is vitamins. So these vitamins can be defined as the organic compounds required in small quantities, so that is required for the maintenance of optimum growth and health, are called as the vitamins. So these vitamins can be classified into two types: fat soluble vitamins and water soluble vitamins. So when you see the classification, so as I told you, we have fat soluble and water soluble. So fat soluble vitamins are A, D, E, K. Vitamin A, D, E and K are the fat soluble vitamins, and remaining vitamins are water soluble vitamins. Again, in water soluble vitamins we have two types. One is B complex vitamins and vitamin C. So vitamin C also water soluble, but it is not a B complex vitamin. So that's about the classification of vitamins into fat soluble vitamins and water soluble vitamins. First we'll see about the fat soluble vitamins, and then go into details of water soluble vitamins. Coming to fat soluble vitamin, first one, vitamin A. So vitamin A, when you see its structure, chemistry, it exists in three forms. One is alcohol form, aldehyde form and acid form. So the alcohol form of vitamin A is called as retinol, aldehyde form is retinal, and the carboxyl group, when it is present in its side chain, we call it as retinoic acids. So all these retinal, retinol and retinoic acid, they have vitamin A activity, so that's why we call them as vitamers. So the vitamers of vitamin A are retinal, retinol and retinoic acid. And coming to its absorption transport. So as you know, fat soluble vitamins, all the fat solubles, lipids are fats, they require bile salts for their digestion and absorption. So bile salts are required for the digestion and absorption of vitamin A, and for the transport we require the lipoproteins, and the lipoprotein here involved in the transport of vitamin A is chylomicrons. So chylomicrons, they carry vitamin A from the intestine, and from liver it is transported to the extrahepatic tissues by binding with a protein called as retinal binding protein. So it is a plasma protein. The function of this plasma protein is it transports the vitamin A from the liver to the target tissues. Right? And now coming to the vitamin A metabolism. So it exists in three forms, as we discussed. It exists in retinal, aldehyde form, retinol, alcohol form and retinoic acid. So whatever the retinal will take in the form of beta carotene. So beta carotene is nothing but a provitamin A. So provitamin form of vitamin A is beta carotene. That beta carotene undergoes cleavage and is converted into retinal. Right? Coming to functions of vitamin A, it is mainly involved in vision. So there is a pigment called as rhodopsin involved in the dim light vision. So that rhodopsin it is a conjugate protein. It has opsin as a protein component, and it has a non-protein component, prosthetic group 11-cis retinal. So 11-cis retinal plus opsin, it forms the rhodopsin. So when light strikes the retina, and that rhodopsin is cleaved into all-trans retinal and opsin. So that all-trans retinal, which is formed from the 11-cis retinal, so conversion of 11-cis retinal to all-trans retinal occurs through a series of intermediates, and during this one intermediate, that is metarhodopsin, is formed. That metarhodopsin is the reason for the generation of hyperpolarization, and that generates the nerve impulse. So that's how it plays a role in the vision. And again, this all-trans retinal, through a series of reactions catalyzed by dehydrogenases, is again converted into 11-cis retinal. So these cyclic events, we call them as Wall's visual cycle. So this is a cyclic event where all-trans retinal, which is generated from the 11-cis retinal, is again converted into 11-cis retinal by action of dehydrogenases. So that are present mainly in the liver. Right? So this is the role of vitamin A in vision. Coming to other roles So in addition to vision, vitamin A has other important role, like it helps in the growth and differentiation of the tissues. That is one more important role. And this vitamin A also acts as antioxidant. So beta carotene, it has a role as antioxidant. It acts against the free radicals, prevents the accumulation of free radicals. So that's why we call it as antioxidants. And one of the vitamin with antioxidant property is vitamin A, and that is because of the beta carotene. And this vitamin A is also involved in the maintenance of epithelium, and in this way it helps in the reproduction. And apart from that, when you see vitamin A, mechanism of action is similar to that of steroid hormones, right? So it acts like a steroid hormone, because steroid hormones, they have intracellular receptors. Those intracellular receptors, they bind with a specific element on the DNA. We call it as hormone response element. So that activates the particular genes and produces the proteins required for the growth and differentiation. So this similar type of action is there for vitamin A. So that's why its mechanism of action is like that of steroid hormones. So those are the other important functions of vitamin A in addition to vision. And coming to deficiency of vitamin A, what happens in case of vitamin A deficiency? It leads to night blindness or nyctalopia. So it is called as night blindness or nyctalopia. So there is decreased vision in case of dim light. So whenever a person enters into dim light areas, or whenever there is low light regions, so in those cases, so there is difficulty in seeing. So that is called as night blindness. They cannot see in night, right? It is also called as nyctalopia. That is because of deficiency of vitamin A. And apart from that, the other important condition in case of vitamin A deficiency is xerophthalmia. So xerophthalmia is a dryness of the conjunctiva. So vitamin A deficiency leads to dryness of conjunctiva, that is called as xerophthalmia. And so when it is not treated, it leads to a condition called as keratomalacia. Both night blindness and xerophthalmia can be reversible, so when you treat, but when it is not treated, it leads to irreversible damage called as keratomalacia. So what are Biddle spots? Biddle spots are seen in case of vitamin A deficiency. These are nothing but grayish triangular spots seen in the eye. Those spots are called as Biddle spots. Those are the important characteristic feature of xerophthalmia. And keratomalacia is softening of the cornea takes place in case of keratomalacia, and that is the severe form of vitamin A deficiency. So when there it leads to complete blindness. So that is the significance of keratomalacia. And apart from the eye manifestations, we have some skin manifestations, like in vitamin A deficiency it leads to hyperkeratosis. So there is increased skin infections are seen in case of vitamin A deficiency. So that's about the deficiency manifestations of vitamin A. Now coming to RDA, how much amount of vitamin A is required per day. So in case of children, the requirement is 400 to 600 micrograms per day, and in case of adults it is around 750 to 1000 micrograms per day, and in case of pregnancy the requirement is 1000 micrograms per day, and women require 750 micrograms per day. So that is the requirement, daily requirement of vitamin A. And coming to sources, what are the sources for vitamin A? When you take animal sources like liver, kidney, egg yolk, butter, cheese, so milk and milk products, and apart from that we have liver as the animal sources. And coming to plant sources, carrot, papaya, mangoes, so those are the important sources for the vitamin A. And whenever the daily intake exceeds 1500 micrograms per day for long periods, it leads to accumulation of vitamin A in the body, and that leads to a condition called as hypervitaminosis A. So as you know, fat soluble vitamins, they can be stored in our body. So when you take in excess, they accumulate in our body, and that leads to a condition called as hypervitaminosis. If it is A, we call it as hypervitaminosis A. What happens when you take excess amount of vitamin A than the required amount per day for long periods? It leads to skin becomes dry and pruritic, that is one manifestation. So there is accumulation of vitamin A in the liver because that vitamin A is stored in the liver, and that leads to enlargement of the liver. We call it as hepatomegaly. Apart from that, it leads to cirrhosis of liver. And the other important feature is, in case of pregnancy, when you take excess amount of vitamin A, it leads to fetal resorption. So they are the important features of hypervitaminosis A. Yes, that's about the vitamin A. And now coming to another vitamin, fat soluble vitamin, vitamin D. It is also called as sunshine vitamin. So coming to its chemistry, how it is formed in our body. So there is one intermediate which is formed from the cholesterol metabolism, that is called as 7-dehydrocholesterol. So that 7-dehydrocholesterol is used in the synthesis of the active form of vitamin D called as calcitriol. So when light strikes, UV rays fall on the skin, that 7-dehydrocholesterol is converted to cholecalciferol, and that cholecalciferol undergoes two hydroxylations. So one in the liver, and in liver there is one enzyme called as 25-hydroxylase. That the action of enzyme, that is 25-hydroxylase on cholecalciferol, results in the formation of a compound called as calcidiol. Right? 25-hydroxycholecalciferol, or simply you can call it as calcidiol. So that calcidiol now enters into kidney. In kidney, by the action of enzyme called as 1-alpha-hydroxylase, that 25-hydroxycholecalciferol is now converted into calcitriol. So calcitriol is also called as 1,25-dihydroxycholecalciferol. So this is the active form of vitamin in our body, calcitriol. So the provitamin is calciferol, that is called as vitamin D3, and that is converted to the active form of vitamin calcitriol by the action of two enzymes, the one present in the liver and the other one is in kidney. Right. So here you can see how that 7-dehydrocholesterol, which is the intermediate of cholesterol metabolism, is converted to the active form of vitamin D, that is calcitriol, by the action of enzymes 25-hydroxylase in the liver and 1-alpha-hydroxylase in the kidney. Now, what are the functions of vitamin D? So vitamin D exerts its functions, and it has effect on intestine, it has effect on kidney, it has effect on bones. So what are the functions of vitamin D? So we'll discuss under three headings. Its effect on, first, its effect on intestine. So what is the effect of calcitriol, the active form of vitamin D, on intestine? So calcitriol is involved in the increased absorption of calcium from the intestine. So this is brought by increased synthesis of a protein called as calcium binding protein, calbindin. So that calbindin synthesis is increased by calcitriol. So calcitriol enters into the cells, there it binds with the intracellular receptors and it enters into the nucleus. In the nucleus, it binds to a specific region of the DNA where it activates a gene which codes for the calbindin. So once calbindin is synthesized, that calbindin function is it binds with the calcium in the intestine and helps in the absorption of the calcium. So in this way, calcitriol, its effect on intestine is it increases the absorption of calcium from the intestine. So that is the effect of calcitriol on the intestine. And other effect is effect on bone. So this calcitriol is involved in the bone resorption. So it increases the activity of cells which increase the demineralization of the bone. Right. So that's how vitamin D increases the blood calcium level by increasing the bone resorption, bone demineralization. Right. Now coming to another effect on the kidney. So vitamin D, the active form of vitamin D, calcitriol, is involved in the reabsorption of calcium from the kidneys. So that is the effect of vitamin D on kidney. So when you see overall effect of vitamin D on calcium level, it increases the blood calcium level. Right? So that is the effect of vitamin D on calcium level. And when you see in whole, the vitamin D function is it is concerned with the regulation of calcium level in the blood. Right? So it always tries to increase the blood calcium level by increasing the absorption, by mobilizing the calcium from the bone, and by increasing the absorption from the kidneys. Right? So this is the effect or the functions of vitamin D. And what happens in case of vitamin D deficiency? It leads to two conditions called as, one is rickets and another one is osteomalacia. So rickets, in both the cases there are bone deformities. Rickets is seen in children and osteomalacia is seen in adults. So these are the two conditions. So what happens in rickets? So in rickets generally there is bone deformities. There is bow legs, knock knees, pigeon chest. There is boozing of frontal bones. So these are the important features of rickets seen in case of children. And in case of osteomalacia, so there is bone deformities. There is increased risk of fractures in case of osteomalacia because there is increased osteoporosis. So there is a condition called as osteoporosis. So that is because of the increased mobilization of calcium from the bone. So there is increased mobilization of calcium from the bone, so that leads to weak bones. So because of these weak bones, it leads to increased risk of bone fractures. So that is the reason behind increased risk of bone fractures in case of old age people. So that is we can consider that as osteomalacia. That is because of vitamin D deficiency in case of adults. And what is the daily requirement of vitamin D? So here the daily requirement is 10 micrograms per day in case of children, and adults require 5 to 10 micrograms, and in case of pregnancy the requirement is 10 micrograms per day. So when you are expressing the international units, it can be expressed as 400 international units in case of children, and in case of adults it is around 200 international units. And what are the sources of vitamin D? The source of vitamin D is sunlight. Exposure to sunlight leads to increased synthesis of the active form of vitamin D, calcitriol. And apart from that, we have fish liver oil, and fish are the rich sources for the vitamin D. Apart from that, the other source is egg yolk. So yellow part of the egg is it has vitamin D. So these are the sources for the vitamin D. And whenever you take excess amount of vitamin D, it also leads to increased accumulation of vitamin D, and that leads to a condition called as hypervitaminosis D. So how much amount leads to hypervitaminosis D? So when you take 1500 international units per day for long periods, it leads to hypervitaminosis D. So what happens in this hypervitaminosis D? The important features of this condition are hypercalcemia. As you know that vitamin D, it increases the blood calcium level, and when you are taking excess amount of vitamin D, it leads to hypercalcemia. And apart from that, it leads to metastatic calcification. There is calcification of tissues. So calcium gets deposited in the tissues. So that condition we call it as metastatic calcification. So again, that is again because of increased calcium level in the blood. So apart from that, it leads to renal calculi. So that increased calcium in the blood, hypercalcemia, leads to formation of renal stones. We call it as renal calculi. So one type of renal stones are formed from the calcium, and that is seen in case of hypervitaminosis D. And apart from that, there is weakness and polyuria and vomiting are seen in case of excess amount of vitamin D. That is in a condition called as hypervitaminosis D. Right. So that's about the vitamin D. Now coming to another fat soluble vitamin, vitamin E. So vitamin E, when you see its structure, it has a particular type of ring called as Tocol ring, and there are different types of vitamin E forms. So like alpha tocopherol, beta tocopherol, gamma tocopherol, like that. So the most important form of tocopherol is alpha tocopherol. So it is a 5,7,8 trimethyl tocol. We call it as alpha tocopherol. And when you see this alpha tocopherol, it has the vitamin E function. So there are different types of tocopherols, but the most important tocopherol with the vitamin E function is alpha tocopherol. What are the functions of vitamin E? Vitamin E acts as antioxidant. So we discussed in case of vitamin A. So vitamin A has antioxidant property, and another vitamin with antioxidant function is vitamin E. So as it is having vitamin antioxidant property, it boosts the immune system. Apart from that, it reduces the oxidation of LDL. So free radicals are responsible for the oxidation of LDL. When LDL is oxidized, it leads to atherosclerosis, accumulation of LDL in the arteries, and that is prevented by this vitamin E. So vitamin E generally prevents the oxidation of LDL. So that oxidase form of LDL is atherogenic agent, and vitamin E also prevents early aging. That is one more important function of vitamin E, and it may be involved in the electron transport chain. That is, there is one mobile component of electron transport chain, that is coenzyme Q. It may be required for the synthesis of coenzyme Q. So apart from that, this vitamin E may be involved in the nucleic acid synthesis. So these are the important functions of vitamin E, and the most important function of vitamin E is it acts as an antioxidant. So what happens in case of vitamin E deficiency? So whenever there is vitamin E deficiency is there, it leads to increased accumulation of free radicals, and that in the muscles it leads to muscular dystrophy, and when it affects the cerebellum, it leads to cerebellar ataxia and retinopathy is seen. Apart from that, you can see peripheral neuropathy and hemolytic anemia. So when free radicals are accumulated in the erythrocytes, those erythrocytes are damaged by the free radicals whenever there is deficiency of vitamin E. So it leads to a condition called as hemolytic anemia. So these are the deficiency manifestations of vitamin E. Coming to the requirement, daily requirement RDA for vitamin E is, the requirement is 10 milligrams per day in case of men, and in case of women it is 8 milligrams per day. In case of pregnancy, the requirement is more, it is again 12 milligrams per day. In case of lactation, the requirement is 12 milligrams per day. And coming to sources, this vitamin E is present in all the vegetable oils like cottonseed oil, sunflower oil. So all these vegetable oils, they have vitamin E. They are rich in vitamin E. And now coming to vitamin K. So another fat soluble vitamin, the last fat soluble vitamin, vitamin K. So this K stands for coagulation, and the main function of vitamin K is it is involved in the coagulation. So that's why it is named as vitamin K. Coming to its chemistry, so this vitamin K has different forms: phylloquinone, minoquinone, menadione. So the different forms which have the vitamin K activity. So menadione is a synthetic preparation, and phylloquinone and minoquinone are, they have the vitamin K function. So what is the mechanism of action of vitamin K? What are the functions of vitamin K? So K stands for coagulation. It has a role in coagulation. This vitamin K is involved in the coagulation because it activates the factors which are involved in the coagulation, right? So for the activation of those factors, factor 2, factor 7, factor 9 and factor 10, we require conversion of glutamic acid into gamma carboxy glutamic acid. So for this post-translational modification of these clotting factors, what is required? We require vitamin K as the cofactor. So that's how there is only one fat soluble vitamin with coenzyme function, that is vitamin K. So it is required as a coenzyme in the conversion or post-translational modification of clotting factors, where there is conversion of glutamic acid into gamma carboxy glutamic acid. Right. So when that glutamic acid is converted into gamma carboxy glutamic acid, those clotting factors are now activated. So once they are activated, they are involved in the coagulation. So basically vitamin K is required for coagulation. So without vitamin K, those factors cannot be activated, and when they are not activated, it leads to continuous bleeding. So we cannot attain that coagulation. So in this conversion of glutamic acid to gamma carboxy glutamic acid, vitamin K, which is quinone form, is converted to quinol form. That the active form of vitamin K is quinol form. So that active form of quinol form, once it is involved in the post-translation modification, gamma carboxylation of glutamic acid, now after that gamma carboxylation, it will be converted to inactive form called as epoxide form. So that epoxide form is again converted into vitamin K quinone form, and that is catalyzed by an enzyme called as epoxide reductase. So this epoxide reductase is the site of action of some important anticoagulants like dicumarel and warfarin. So that's about the mechanism of action of vitamin K, its functions. It acts as a it helps in the coagulation, right? So those are the functions, blood coagulation. Apart from that, it is also involved in the oxidative phosphorylation, where ATP is synthesized in the electron transport chain. So we call it as oxidative phosphorylation. There also vitamin K is required. So deficiency manifestations. What happens in case of vitamin K deficiency? So as we discussed, this is required in the coagulation. So whenever there is vitamin K deficiency, that leads to hemorrhagic disease of newborn. So in case of newborn babies, it leads to a hemorrhagic disease. The bleeding will be seen, internal bleeding. So that hemorrhagic disease of newborn is because of vitamin K deficiency. And apart from that, whenever there is vitamin K deficiency seen in case of children and adults, so there you can see some bright red spots on the skin. That spots are called as ecchymotic patches. So those ecchymotic patches are because of vitamin K deficiency. And prolongation of prothrombin time, and there is delayed bleeding, delayed clotting time is seen in case of vitamin K deficiency. Delayed clotting, prolongation of prothrombin time is seen in vitamin K deficiency, apart from hemorrhagic disease of newborns and ecchymotic patches seen in case of children and adults. So these are the deficiency manifestations of vitamin K. And coming to the daily requirement, the daily requirement of vitamin K is we require 50 to 100 micrograms per day. So actually it is synthesized by the intestinal flora. So whenever you take antibiotics, those intestinal flora are lost, and in those conditions we require 50 to 100 micrograms per day. And apart from that, other sources of vitamin K are green leafy vegetables, and there are some antagonists which act against this vitamin K. Those are called as antagonists. So any substance which acts against the vitamins, we call them as antagonists of those vitamins. In case of vitamin K, those are dicumaril and warfarin. So they prevent the action of vitamin K by inhibiting the reaction in which the inactive form of vitamin K is converted into the active form of vitamin K. So this is about the requirements, sources and antagonists of vitamin K. Thank you.